So I'm fairly certain that this isn't unique to my practice, but it is something that I keep seeing. So I wanted to just hop on here and see if anyone else has noticed the same thing. In neurosurgery, we get calls for anytime there's a hemorrhagic stroke, bleed in the brain, whatever the case may be, but specifically like hemorrhagic stroke or a spontaneous brain bleed, whether it's a AVM rupture or a aneurysm rupture. Something that I keep seeing over and over and over again, and it's probably, I don't know if I had to quantify it, I would say close to 90% of the patients. Like, it's much more rare that I don't see this than I do, but it seems like every 90% of patients has a UTI when they're getting admitted for a brain bleed. So I actually was talking with one of the neurologists yesterday, and he's like, yeah, it is pretty often, but maybe he just didn't really care to look into it more, because he was like, well, I'm sure that millions of dollars and a study at UCLA could find this out for us, which was kind of defeatist in a way, because I was more curious about what he saw in his practice, and I guess he did admit to that he sees it quite often. So anyway, does anybody else see that people with brain bleeds are also coming in with UTIs? And if you are, is there something to this? Like, I'm wondering if maybe the patient has the UTI and then that's kind of stressing the body out. Maybe they don't actually notice that they have the UTI, and then that causes the blood pressure to go up, and then that's ultimately what causes the brain bleed, so to speak, because when the blood pressure goes too high, then the vessels in the brain can get weak, and then they burst, and that's where these bleeds can come from, or strokes can come from. So I don't know, like, that's just kind of a working theory. Has anybody else seen it? Anybody else have any thoughts on it? I'd like to know. Thanks.